In this video, we'll discuss about circulatory shock. What is shock? How it is classified? Shock is not a disease. Shock is a clinical syndrome. So, this one is the clinical syndrome that result from inadequate tissue perforation. Inadequate tissue perforation. Tissue perforation not happening. Okay, so that one name is called shock. Classification of shock, they are 4 type of shock: hypovolemic, then distributive, then obstructive, then cardiogenic. There are 4 type of shock. Here we want to discuss only this hypovolemic shock. Less amount of fluid. Okay, what is hypovolemic shock? Less amount of fluid. What is happening? That fluid is less in that vascular compartment. So here that fluid is less in vascular compartment. So what is that cause? That is going to cause reduction in that cardiac output. Reduction in cardiac output. So what is that cause? Going to cause reduction in cardiac output. So inadequate tissue perforation. So here inadequate tissue perforation not happening. In hypovolemic shock caused by 3 things. First and foremost, there would be blood loss. Second thing, there would be fluid loss. And third would be fluid loss only, but here burn. So 3 things causes this hypovolemic shock. If that hypovolemic shock is occurring directly because of loss of blood, that one name is called as directly because of loss of blood causes means hemorrhagic shock. Then second one is fluid loss. If that blood volume is happening, loss of fluid, what can occur because of GIT causes, or which can also occur because of associated with kidney. What would be in GIT cause? GIT causes due to excessive or severe diarrhea or vomiting. What would be the kidney causes? Because of diabetes mellitus, then diabetes insipidus, and uses of diuretics. All the things would be kidney causes of fluid from kidney. This one also causes burn, also causes, simply called this one is the burn shock. These 2 things we are calling fluid loss, also called as dehydration of shock. So this one dehydration of shock. Next, how to grade of hypovolemic shock as per ATLS guidelines, advanced trauma life support. They have 4 grade or 4 classes. Classes 1 are grade 1, 2, 3 and 4. So class 1, the loss of blood 750 ml. Grade 2, 750 to 1500 ml. Then grade 3, 1500 to 2000 ml. Grade 4, more than 2000. So grade 3, hemorrhagic, 1.8 liter of loss. So hemorrhage means 1.8 liter of blood. So we can tell in the form of percentage. We can tell in that form of percentage. Class 1 less than 15%. Class 2 15 to 30%. Class 3 this hemorrhagic shock 30 to 40%. This one more than 40%. So here grade 3 1.8 liter of blood loss. Then heart rate here more than 120. Then systolic blood pressure reduced, diastolic blood pressure also reduced. Then rate of respiration more than 30. Then urine output decreased 10 to 20 percentage. Then this one is increasing, rate of respiration increasing, this urine output decreasing. Then extremities pale, last one is mental state aggressive or drowsy. So how we can classify that hypovolemic shock or hemorrhagic shock? Based on the grading, based on how much is the loss of fluid. So all the range, class 1 750 to 750 to 1500, 3500 to 2000, grade 4 more than 2000. Next one is compensatory mechanism. First and foremost compensatory mechanism, as soon as the blood pressure touch as 60 mm mercury is baroreceptor reflex. Baroreceptor reflex operate between 60 to 180 mm mercury. It is quickest compensatory mechanism. Second one is hemoreceptor reflex. When the hemoreceptor reflex operate, the blood pressure fall below 60 mg mercury till 40 mm mercury. The hemoreceptor come under play again. Hemoreceptor try to increasing blood pressure by stimulating that sympathetic nerve system, as well as it will stimulate that respiration, leading to increasing the rate of respiration. Third important one and the most powerful reflex which decreases blood pressure below 40 below 40 mm mercury. It operate blood pressure 15 to 20 mm mercury. It is known as CNS ischemic response. This one cushioning reflex. It leads to ischemic of that organ and leads to organ failure. Next one is capillary fluid shift. The shift of that fluid which is occurring from interstitial space into that capillaries. Next one is reverse stress relaxation. Two things we want to remember here. That is called that stress relaxation and reverse relaxation. Stress relaxation and another one is reverse relaxation. Stress relaxation, whenever increasing blood pressure, what is going to be occur? There will be vasodilation. Why? To accumulate more amount of blood, and whenever there is decreased blood pressure, there is going to be vasoconstriction again to accumulate less amount of blood. So decreasing blood pressure resulting vasoconstriction because of local mechanism involved in that level of arteries, what is called as reverse stress relaxation. So here vasoconstriction, increasing blood pressure. Next one is RAS, renin angiotensin aldosterone system. This occur lately and this fall under the category of long-term regulation. So what is going to be happen? Renin, what is producing, secreted from kidney, causes production of angiotensin 2, which is the very powerful vasoconstrictor. Not only that, there is also stimulation of aldosterone, which help So stimulation of aldosterone which help in sodium and water resorptions. Then try to back that normal blood pressure. Next one is increased secretion of ADH from that posterior pituitary. When the ADH is produced, again there is conservation of water and try to increasing blood pressure. Last compensatory mechanism, stimulation of adrenal medulla. Okay, so stimulated there is relax of catecholamine. Once that catecholamine are released, again there are going to cause a sympathetic stimulation. So catecholamine also stimulate this reticular formation. So these are the 8 compensatory mechanism. Next one is clinical features. We also want to write why these are occur. First one is tachycardia because of sympathetic stimulation. Tachycardia. Second one is hypotension because of loss of fluid. Third one is skin going to be pale and cold and clammy. Why that pale and cold? Because of severe vasoconstriction which occur in that cutaneous. Okay, so this one will occur in cutaneous. So that reason only the skin would be cold condition. So one thing is loss of blood and the second thing is sympathetic. Clammy means increasing amount of sweat. Then oligonuria condition. Why? Because of renal vasoconstriction there is going to then hyperventilation. Why? Because of stimulation of chemoreceptor. So this hyperventilation, increased rate of breathing. What is hyperventilation? Increased rate of breath rate. Okay, increased rate of breathing and increasing depth of breath. Last one is anxious and restless because of adrenal medulla is going to release catecholamine which are going to again stimulate our reticular formation, make patient anxious and restless. So this is all about clinical features.